This is The Road Out, Understanding Addiction and Recovery for You and Your Loved One, with Dr. Margaret Bauman, Medical Director, Psychiatry and Addiction Medicine at Cottage Health, San Luis Obispo Outpatient Program, and Dr. Paul Erickson, Medical Director, Psychiatry and Addiction Medicine at Cottage Health. Today we're going to talk about how to approach a loved one who you think has a problem. Doctors, how do you start a conversation?
Oh, this is a tough one. This one's tough. But again, I think approaching it with not when you're angry, not when you're in the middle of a fight, but to wait until everyone's calm and can talk and perhaps listen, and to just begin by saying, I've noticed that you're drinking a little bit more than maybe you should be. Just something simple like that.
Very often people will have fights and argue because the family member who's affected is so hurt and so angry about what's going on that the conversations start off in the form of a fight. And that's often not so helpful, as Dr. Bauman is saying.
Yeah.
I think if you can collect your thoughts and approach the person you care about at a time that's calmer and they're willing to listen and describe what it is you're seeing and how it's affecting you, that's a good way to begin the conversation.
So it's not best to confront the person. It's best to try a different approach.
I would say that talking with them about what you're seeing and how it's affecting you is a constructive form of confronting the problem. I think confronting in the sense of being more aggressive or accusatory does not help.
Right, yeah. And I liked what you said. It's not that you're confronting the person, you're confronting the problem. Because that's two very different things. If the person feels like they are being confronted, oftentimes they get very defensive, and that's the end of them hearing what you're saying.
That's when they just say they deny they have a problem.
Right.
And so you don't want them to do that. What do you do then if that happens?
I would add it can also help not only to describe what you're seeing and what your concern is, but asking them how do they look at it. So you can get a sense about what it is that they're thinking. They may surprise you and say, yeah, I have been worried about this.
Right.
And I do think I have a problem.
Right.
What if their drug or alcohol use is causing you so much stress you can't take it anymore? What do you do?
That's not unusual because this is a kind of problem that affects somebody every day. And if it's a family, it's affecting not only the spouse, but the children every day. And people become very stressed and don't know what to do. And I think a starting point is to go get some help for yourself.
Right. Yeah, this is the point where, as you ask, if you're so stressed you just can't take it anymore, this is the point where you reach out to other people, whether it's perhaps a friend or another family member or your own physician or your spouse, if this is the person you're concerned about. You mention it to your spouse's doctor, but I do agree, you've got to get help for yourself at that point.
One way to get help is to go to Al-Anon. And Al-Anon is a meeting that is specifically for family members who have a person in their family with an alcohol or drug problem.
Right, and then there's Alateen for young people, those teenagers who are concerned perhaps because they have a parent who is an alcoholic or abusing drugs, or they may have an older sibling that's having the same problem, and there's a lot of chaos at home, and a lot of times that's really affecting the teenager.
And a counselor can be very helpful. I would recommend that you ask around carefully for somebody who really has experience with drug and alcohol problems, because not every counselor has that experience and expertise.
Right.
Now, are we talking about seeing the counselor with the person or without the person?
Well, sometimes you may have to see them without the person, just so you can get a better handle on things. If the person that you're concerned about, your loved one, is willing to do that, that's great. But oftentimes that person is still in denial about the issue, but you still need to go and see someone just to get a handle on how to proceed at this point.
That counselor may help you make a plan for how to talk with your loved one. They may help you decide what the limit is for you and when you may ask somebody to move out of the home, for instance, if things have become so destructive.
Right.
Okay, we've been talking The Road Out, Understanding Addiction and Recovery for You and Your Loved One with Dr. Margaret Bauman, Medical Director, Psychiatry and Addiction Medicine, Cottage Health, San Luis Obispo Outpatient Program, and Dr. Paul Erickson, Medical Director, Psychiatry and Addiction Medicine at Cottage Health. If you'd like to listen to this again or share with a friend, visit cottagehealth.org/The Road Out. That's cottagehealth.org/The Road Out.